not the actual answer of that. And we want our student to think critically on that particular scenario. So our words choice should be very different from the scenario and from the instructor as well. That should be different. So that the student will not be easily pick that answer. Okay, this is one of the point. Secondly, some of the word, for example, angina mean chest pain, and chest pain is also the similar meaning. Yes. So in this regard, that becomes very difficult for educator to rate, because when you will make a key, you will have a problem. This is not only problem for the student. Being an educator, when we will make a key, so we will think about it. We need to mark this chest pain or angina. What we are asking. Is it clear? So for developing this question, you can ask. So you can write some of the characteristics here, and then you can ask, this is an epigastric pain, or is it a chest pain, or is it a muscular pain, or is it for any kind of destructor you can have. But do not write here this chest pain. You can write only the characteristic that the patient is having a pain that is related to the left arm, patient is having a sweating, and patient is unable to sit properly, he is lean forward. So these kind of characteristics is giving some point that maybe the patient is cardiac patient. But when you are giving the distractors, so definitely we need to choose that is it muscular, or is it epigastric, or is it a cardiac pain. Is it clear? Thank you.
Okay, so one more thing, when you are making the MCQ, please try not to give any abbreviation, or you can use a standard abbreviation. For example, if I doesn't have any experience in ER, maybe I don't know what is this ER or this echo. Maybe this word has an emergency to answer this one.
Emergency.
Okay, so try to give a standard abbreviation, or if you know that you have used this word in the classroom, in the clinical area, so student can answer it easily. Okay, so try to give that. The other thing is when you are making the stem wording should be in the range of 30 to 120 words. Okay, not too short, not too long. Because when we are assessing the students, if you will give a more big scenario, 5 or 6 lines, so it will be difficult for the student, because he or she will attempt more time to the one scenario only. Okay, so student will not be able to manage the time. So try to give the scenario only in the next 30 to 120 words. Okay. The other thing is, if you are making the stem, if it is long stem, the distractors should be short. If the distractors are long, the stem should be short. It should be vice versa. So the time they will be able to manage easily. Okay. So that's it. Okay. Thank you so much.
Diminished due to I think स्टेटमेंट थोड़ा सा मोर अगर डिटेल से हो तो बेहतर हो.
स्टेटमेंट क्या?
स्टेटमेंट बहुत ज़्यादा कंसाइज है, अगर और ज़्यादा डिटेल से हो तो बेहतर हो. अभी स्टार्ट इस तरह हुआ है कि ब्लड सप्लाई, तो थोड़ा सा और अगर एक सिनेरियो क्रिएट करे या इस तरीके से स्टेटमेंट थोड़ा सा मोर हम डिटेल से करें तो बेहतर.
So वैसे ये कौन से टाइप का क्वेश्चन है? Is it recall, reasoning?
Recall.
Any other comment? Any other comment?
Blood supply to
No, no, sorry. Thank you.
There is a confusion in the question towards the brain. Blood supply towards the brain. So the blood supply starts from the heart to the brain. So any rupture near the heart would not be the option. Maybe rupture of aorta, then they may be not
chapter as well.
Yes.
Any other thoughts? The sectors no भी मसला नहीं.
The D option is, I think, also need to change the word pathogenic condition.
So means this is not clear statement what you want
Yes.
to say. Which condition is leading to the patient condition like blood supply, क्या लिखा है blood supply towards the brain. मतलब किसी disease की तरफ वो लेके दिखा रही what you want to say. Okay, this is something incomplete. Any other thing? Recall तो है but this is just a statement. Like scenario या question नहीं लग रहा है. It needs some more description so that you can link it with this. So this is your own assumption, your own understanding. But being a student, it is very difficult to understand that मुझे किसको किससे link करके answer करना है. Relevancy is missing in this question. Any other comments? You are thinking something. Okay?
Clear.
Done? Okay. So बाकी वही है कि shorts इसका okay. For example, again. हम अगर बात करें alphabetical geometry. So she has given the description, or you can say this. अगर आपने detail में लिखे, no need to write this.
Yes.
Okay? Because already written here, so do not make it increase the length of the chapter. Just make it easier. ठीक है, thank you. Next, हाँ.
All are a function of lever except one. So very simple.
Any comment on this one? Can we negative lead in that. So we have said before that there should not be a negative lead in. Okay. Any other issue in this question? Very concise. Okay. Can we convert it in any other type of question?
I think all options are correct.
Okay. So being a student, she said that all options are correct. So which one she will not mark? Okay. Any other thought?
ऑप्शंस हमारे पास बहुत ज़्यादा है, एक ज़्यादा डेटा सीखते हैं, तो एक कंसाइज डेटा और एक मोस्ट रिलेटेड होंगे तो उसके साथ
It should be consistency and relevancy. Okay. The other thing मुझे ऐसा लग रहा है, for example, if she want to set जैसे उसने कहा कि all options are correct. So being a student, if I am thinking like this, so maybe we are not assessing to your knowledge here. Okay. For example, all options are correct. So here you can convert this question to multiple true false. For example, you can say all of the functions of the lever. Which one of the lever? Which one of the forming are lever functions and which one of the forming are not lever functions? Okay, you can modify statement like this. So means जो है हमको true tick कर दे, जो नहीं हमको false कर दे. So multiple true false में this question can convert, but it is not a scenario based answer. Okay, because on the single line you cannot assess even a recall question. Okay, you can convert it to multiple true false. Okay, and the other thing is it should not be any negative reason. Thank you so much. Okay, so need to work a little bit more. Okay, thank you so much. Okay, so as we were discussing before, this is the anatomy of the questions. We should have a stand, we should have a lead in, we should have options, and we should have the sectors and a key. Okay, so this is all anatomy of a best answer question or a stand-alone question. Okay, this is all the parts of the question. Without this, your question will be incomplete or not an efficient question. Okay, so you can see this question. Sorry? writing that what you want from your student. Like in this question you wrote, which one of the most important assessment. So this is lead in, what you want from your student. Okay? So this will call a lead in. So that's I said before, there should not be a negative lead in. Okay? So can I move forward? Okay, so like in this question you can see there is a scenario, there is a lead in. Lead in is a, what is the primary diagnose, and there is a 4 options, and there is a key. Where is the key, by the way? Where is the key? Which one is the answer? Okay, this is understanding. So when you are submitting your question to the question bank or to the examination room, you are giving this one with the key. But when they are printing, they are moving that key. So for the students, you will not give the paper with the key. Okay, this is for your OMR sheet, for your examination bank, that they have to mark there. Okay, when they are taking the print, they are taking this out the key. Okay, so this is the question. You can see the stamp again. You can see the lead in the second line, as this question said before, that what you want to set, it should be separately written, so the students can focus that what is expected from this question. Okay, and it has 4 options. You can see the alphabetical order. Okay, H, E, M, Y, and all are homogeneous, like all are related to the disease. Not one is the disease, one is the symptom, one is the management. All are homogeneous options. Okay, so this is just you can take it as a sample. Okay, so quickly we can have some of the advantages and disadvantages from you. अभी तक हमने काफी पढ़ लिया, तो what comes in your mind and what are the advantages of the MCQs and what are the disadvantages of the MCQs?
आई थिंक जिस तरह हम एमसीक्यू लिखते हैं, एमसीक्यूज के लिए इतना डिटेल से नहीं करते। आप सुपरफिशियली स्टूडेंट लेते हैं, तो स्टूडेंट सुपरफिशियली स्टडी करते हैं, डीप स्टडी नहीं करते।
Because अगर आप रीजनिंग के क्वेश्चन में आते हो, those students who will have a superficial study, they will not be able to attempt that one. Those students, those who have read it deeply from the multiple sources, they will be able to identify that what is the problem in this issue, in this question, and what you want to assess, and what we have asked to answer this one. So they will only be able to answer that question. And the disadvantage or advantage.
एक्सक्यूज में एडवांटेज ये है कि वो सब्जेक्टिविटी जो है वो कम हो जाती है, क्योंकि अगर आप जो सब्जेक्टिव टाइप के जो क्वेश्चन होते हैं या आप जो डिफाइन करते हैं उसके जो शॉर्ट आंसर, उसमें सब्जेक्टिविटी होती है, क्या इस बच्चे ने जो है अच्छा लिखा है या किसी की राइटिंग खूबसूरत है, तो आप नंबर कैसे दें। लेकिन एमसीक्यूज में ये है कि वो ऑब्जेक्टिविटी है, ज़ाहिर जितने करेक्ट होंगे उतने राइट आंसर होंगे। और ऑब्जेक्टिविटी में जो ऑब्जेक्टिव्स हैं उसमें ये कि डिसएडवांटेजेस हम नहीं कह सकते, ये कि मोर टाइम आपको लगता है उस पर, क्योंकि ओवरऑल आप कंस्ट्रक्ट करेंगे, क्योंकि ओवरऑल पूरे बुक को जो है आपने अगर 60 क्वेश्चन में पूरे सिलेबस को आपने डालना होता है, तो दैट इज अ प्लस पॉइंट कि आप स्टूडेंट को जो पूरा असेस कर देते हैं। हर स्टूडेंट भी जो है उसका वो गैस नहीं लग सकता, लेकिन ये सेट
Very good one. Thank you so much. Any other?
मैं भी यही एग्री करना चाहती सर के साथ कि अगर आपको उसमें 100% ठीक है, तो राइटिंग मैटेरियल्स में राइटिंग तो है ही, आपका अगर 100% ठीक है तो आपने 100% नंबर ले लीजिए, उसमें कहीं करके कोई नंबर की कटिंग नहीं है। सब्जेक्टिव में कितना भी अच्छा लिखते हैं, लेकिन आप नंबर यूज करते हैं। स्टूडेंट को जो है इसके लिए पढ़ना पड़ता है बहुत ज़्यादा, जिससे मतलब है कि शॉर्ट क्वेश्चन है उनके लिए इतना ज़्यादा नहीं होगा, जो ठीक है 1-2 लाइन लिखी, 4 लिखी, कुछ कॉन्सेप्ट नहीं थे, लेकिन जो एमसीक्यूज हैं उनके लिए उनका कॉन्सेप्ट क्लियर होना लाजमी होता है, ताकि वो जो है उसको रिस्पॉन्स कर सकें। और इसके साथ साथ जो है ना टीचर के लिए ये होता है कि उसे भी अच्छे से पूरा का पूरा जो है ना सिलेबस उसको देखना पड़ता है कि उसे पूरे सिलेबस को कैसे कवर करना है। शॉर्ट क्वेश्चन जो है ना वो बनाना इजी हो जाता है एक इंस्ट्रक्टर के लिए, लेकिन जो एमसीक्यूज हैं उसको बनाने के लिए उसको बहुत ज़्यादा
सिलेबस को कैसे कवर करना है, we will talk about the toss for after maybe 10-15 minutes, then we will know that how we are covering all the content.
जी एमसीक्यूज के लिए उसके एडवांटेजेस में ये है कि इतने शॉर्ट टाइम में हम लोग सारा सिलेबस ही उसमें कवर हो जाता है, सारा कंटेंट हर पार्ट से हम एमसीक्यूज बनाते हैं, क्विकली असेस कर सकते हैं। और ड्रॉबैक ये टीचर्स के लिए कि काफ़ी टाइम कंज्यूमिंग है, और एक बेनिफिट इसका ये भी है कि इसमें क्रिटिकल थिंकिंग स्टूडेंट्स की इन्वॉल्व होती है, क्योंकि डिफरेंट लेवल के एमसीक्यूज होते हैं, तो वो अपनी ब्रेनस्टॉर्मिंग करके इतने शॉर्ट टाइम में करते हैं, तो ये बेनिफिट है।
Okay, thank you so much. तो इससे पहले मैंने एक बात की थी कि like we are sending this paper to our question bank, but only I want to tell you that whenever you are taking MCQs from the question bank, so try to relate it with your own content. That may be the previous faculty who have made this paper, the distractors may be 2 or 1 she has not discussed in the class. You have discussed, so try to see that whatever you have covered the content in your own class, try to use that one. Don't think that I have covered the COPD and I can simply take the COPD question from the question bank. So try to relate that whatever content you have teach to your student in the class, you can manipulate that. Okay, so don't use the same question as it is that you have taken from the question bank. And thank you so much until now. So now I hand over to Ms. Krishna, but we have to take a break.
He's serving as well. So now we are moving toward the another type of our MCQs. As you had done your activity related to standalone question, which is most commonly used in our different fields. For example, in nursing, in pharmacy, in medicine, we are using it. But there are some other type of MCQs which we are saying that which is not very much common. Maybe you people are using it, but you don't know the name maybe. But very much possibility is that you have not using it in your setting. Okay, so we will further to discuss 2 kinds of MCQs. First one is case clusters, and the second one is extended matching questions. So in the first step, we will discuss about the case clusters. So what you understand from this word case cluster? Any idea comes in your mind? What is case and what is cluster? Yes.
There is one case scenario, and following this case, there is several MCQs.
Okay, very right, very good. That of course there is one case, and in connection of that case we have multiple questions. That could be one, that could be more than one. There could be 2, 3, 4. It depends on what you want to ask from your student or what your case is basically. Okay. Any other idea? No. What this picture is showing to you? One step, and there are options, questions. There are multiple questions. So these branches are basically different questions.
एक बेसिक हमारे पास स्टेम होते हैं, उसके बाद हम एक सिनेरियो बनाते हैं, तो उस स्टेम से भी हम डिफरेंट सिनेरियो ले सकते हैं, और एक सिनेरियो से भी हम डिफरेंट MCQs ले सकते हैं.
If you are saying it as scenarios, so that became more confusing maybe. So
STEM.
That would be STEM.
Yes.
Okay. So and that STEM we are saying different questions. The STEM or the questions. So these are the different. These both are having the same meaning in the case clusters. Okay. So we are looking at the example. This is example. Can you see it? So in above one we had written. Sonia, please refer the scenario from question 32 to 34. Okay, so it means the student have to utilize that particular case for 4 questions from 32 to 35. Yes, case is one, scenario is the one. Okay, but what teacher is saying to them, you need to refer this scenario for question number this and this. And we need to be very clear in this sense that how much questions are leading with that scenario. For example, there may be 2 questions only that are linked to that scenario. So we need to mention the number there. For example, refer the scenario from 32 to 33, and for example 32 and 33. So these are the 2 only questions. But here 4 questions in the connection. 32 to 35. Okay? So this above one is our case. Mr. XYZ having a stroke, paralysis of left side of the body, drooling from the left side of the mouth. He is unable to eat and walk. He developed a 2nd degree gut sore on sacral area. He has an episode of fever with chill. CBC count shows WBC 14,960. Doctors suspect that patient got some autoimmune reactions and he remained in hospital for 2 weeks. After discharge, he is awaiting nursing care at home. So this is the complete scenario. Okay? And now students need to read the stem. And the stem for 32 is a patient autoimmune response is an example of which of the following stressors. So this is a first question linking to that scenario. Is it clear? Am I clear to you? Okay. Then we have 4 destructor there for that particular question. And after that we have next question, that is 33. But students need to look back again for the scenario because this question is again linked with that particular scenario. Okay? So here the teacher is asking, patient is having fever, chill, WBC count and doctor doubt about autoimmune reaction is representing which line of penetration of which of the following lines of defense. Okay? So again we are having four options for this. And of course there would be only one answer. And similar for the following questions. But these 4 questions are linking with the previous one, the main scenario. If you are looking at the third one, nurse is trying to provide dry oxygen and cigarette powder on patient's wound. And what was the wound? Wound is mentioned in the scenario. That the wound is on the sacral area. Okay? So for looking at this patient wound, student need to go back to the scenario again and look at it. Which kind of wound or the patient is having the problem. Is it clear? So every time with linking each question, student will move back to the scenario and see that how he or she will be answer this question. Is it clear? Any question up till now? So these kind of questioning are known as case clusters questions. Okay? In that we are giving one case and we are connecting 3 or 4 or 5. It depends on us how much questioning we are connecting with that.
कुछ ऐसे सब्जेक्ट हैं जिसमें हम सिनेरियो नहीं दे सकते तो क्या ये क्वेश्चन जो हम बना रहे हैं या जो केस क्रिस्टल क्वेश्चंस हम बना रहे हैं उसके ये लिमिटेशन नहीं है इस क्वेश्चंस की
कौन से सब्जेक्ट की बात की आपने
कोई भी सब्जेक्ट फॉर एग्जांपल हम सोशियोलॉजी लेते हैं
ओके let me first discuss that on which subject we can apply. So definitely after that we will discuss on which we can't. So while looking at this question, what comes in your mind? In which kinds of subject this idea can be applicable?
Basic nursing subjects.
Basic nursing subject,
FY,
medical surgical.
yes.
Okay.
Clinical subjects.
Clinical subject, we can apply it in fundamental of nursing, medical surgical nursing, critical care nursing, community health nursing. Okay. Any other idea?
This is from the nursing theory.
Nursing theories, because this question is from the nursing theory. Okay. Yes. Pharmacology.
Yes.
Medical surgical medicine. Okay. Yes. Yes, nursing care plan. That comes under the medical surgical. And in nursing care plan, you can give one scenario, and you can ask the 5 step of your nursing care plan. Okay. So we can apply it in pathophysiology as well, because in above we are giving the case scenario, and then we are asking what is the cause, what is the sign and symptom. In next question we can ask what could be the complication, what diagnostic procedure we can move on. So it is applicable in all the clinical subjects, in all the basic nursing subjects, and it can applicable in nursing theory. It can applicable in research as well. There you can give one research scenario, and you will ask that which kind of research design you will apply. And next you can ask which kind of research sampling technique you can apply. In the further one you can ask the question about the analysis. So in this way it could be applicable in research as well. It could be applicable in statistics as well, because there you can give some sort of data. And in first one you can ask about the descriptive analysis. In the next one you can ask inferential analysis. Then you can move towards the complexity of analysis. So in this way you can apply it in statistics.
It can also apply it in academic writing or English language.
Yes, it is easily applicable in comprehension. In comprehension this method is used. We are giving this comprehension, and we are having this sort of questioning that each answer is coming from that particular part. Okay, and it is applicable in sociology as well, sir. It could be applicable.
But not
I'm
in-
not saying in each and every kind of topic.
Yes.
In some of the topic you can apply it, but in some of the topic you could not apply it. For example, if I'm saying that in anatomy and physiology,
Yes.
so we can't
Not
apply that, because our purpose is to just ask the recall level questioning, where we are asking about the structure and the function only. So this is one of the constraints in that particular subject.
There are.
This easily applicable in maths as well.
Yes.
In maths we can give scenario, and then
Not
we
in
can
the
ask
scenario.
about the different medication of that particular patient. So in this way we can apply it in some, but we have some of the constraints, as I have mentioned, one of the subject, and we have problem of application in that. And any concern or question? Am I clear up till now?
Yes.
Okay, next. So we have stem, laden, and you can see in each question we have laden and options, but stem is only one with these 4 questions. Okay? Scenario. Scenario. The case or the scenario is only one, but laden and the options are multiple. Okay, so now it's your turn, and I had given you time for taking the tea as well during listening. So you can take 5 minutes more for your break, and then we have this activity.
सर हाँ ना वॉशरूम चलते हैं